Good evening, good morning, good afternoon, wherever you are. Welcome to Global Health and Wellness Medical Tourism Incorporation. I would like to share a little bit of the retirement tourism that we have cater or help out whoever needs to relocate to the Philippines at this time. When I say at this time, it's because if you decided to pick the country, and what I am going to share is about the Philippines, and then next time we're gonna talk about retirement in Thailand. So because there's a lot of topics, there's a lot to talk about, and everything is in details. But obviously, if you want to ask more, then it's good that you have to connect with us, and we are 24/7. So let's begin with, where is your origin? Where are you gonna be the departure of origin? So from where you're gonna start your journey, then head towards to the Philippines. And you may decide that you want to take short term at the moment, just to try test the water and feel if you are okay or compromised with the weather and also with the food. So let's say if you decided 6 months to have a short term stay in the Philippines, and prior to that moving, obviously the planning stage is already dealt with, like how much are you gonna be collecting for your pension, and what other resources or what other sources of income that will help you financially. Then what are the medical condition that you have? For instance, if you have a hypertension, high blood, and then you're taking a medication, if you are a diabetic patient, then that's a different story. So all of this is needed, all the information is needed for assessment and what the planning system will be. And that will be included as well, the how is your funds, how is your pension gonna how you're gonna be able to receive, so the banking system, then the visa as well. Because if you decided for 6 months, obviously for Canadian passport holder there is a no visa needed. But if you want the longer, so that's a different story. So that's why we have to go more deeper. Now when it terms to um, let's say if you're single, but then you have some medical issues that needed a personal assistant or personal care or a nurse, we also collaborate with the local there, meaning local nurse, the Filipino, and they are certified, they are registered nurses, or they are registered caregivers or a personal care assistant. And that's the Global Health and Wellness Medical Tourism Incorporation will guide you through. And besides that, we are 24/7. If there is some issues, then there is a customer service, a team support that will answer your question. As the founder, that's my responsibility. Of course, I would like to make you feel that uh, when you decide to relocate and test the water first in the Philippines, especially, you have to decide what is your dream place, meaning where you want to be living, or where do you want to dream to live in the Philippines? Is it gonna be nearby the ocean or near the mountain? But most especially, we have to reassess again. If you have some medical condition, I highly recommend that there is a nearby hospital that's accessible, that they can bring you anytime, and a nearby clinics, it's very very important. So that's why the assessment or the consultation, that's included the questionnaires. So back to the preparation for Canadians relocating or moving to the Philippines, as I mentioned earlier, and it will appear on the screen what you have to be thinking before you make a decision. And the government of Canada are all transparent, and giving all the guidelines. What I am sharing to you, it's coming from them. It's not coming from my own decision or my own opinion. It's coming from them, because it's important also that whatever I give information, that's coming from the government of Canada website when it comes to retirement preparation.